this possibly be effective in somebody who's overweight or unfit? And the answer has to do with visceral fat. Visceral fat is the fat inside your belly. It's not the subcutaneous fat on the surface. And what we know is that exercise burns visceral fat. The visceral fat cells are like an active endocrine organ, pumping out all these inflammatory proteins that do us harm. So the message is abundantly clear. The magic formula is at least 30 minutes of walking a day. If you want to lose some weight, we're talking about 45 to 60 minutes. Even better, get a pedometer. Get your 10,000 steps a day. Now, I went for my brisk walk this morning, and because of this meeting, I had to get here. I got 8,500 steps. So I know that sometime between now and the time this afternoon's conference is over, I'm going to squeeze out another 1,500 steps. Maybe at lunchtime I'll go out to the beach here and walk. But I think that's critical. How about stress? Stress is the unknown risk factor. And in week 3, we're going to concentrate on stress, because stress is like driving your car at 90 miles an hour with your brakes on. It's the really, I love this quote, stress is who you think you should be, whereas relaxation is who you are. Well, early man, when confronted with this little guy, or big guy, this saber-toothed tiger, had what we call a fight or flight response, which really was an innate thing that we have that really helped to prolong our species. And that was when confronted with danger, we would throw out a lot of adrenaline to allow our blood vessels to constrict down a little, shunt blood to our muscles so we could fight the saber-toothed tiger or run. And this is the mechanisms, and you could see with the outpouring of adrenaline, it allowed us to survive. And we would often, as early man, would confront these fight or flight stressful situations about once a week, once every couple weeks. Modern man, there's no more saber-toothed tigers walking around. But modern man faces 20 or 30 stressful episodes a day. We don't realize it's a killer, because the chronic stress response, and by the way, the stress stimuli could be anxiety, depression, hostility, and anger. That's one of the worst, by the way, what we call hot reactors. Social isolation, sadness and frustration. We know, for instance, after bypass surgery, those that develop depression are much higher risk of dying in the next 3 months than those that aren't. These are all part of the cardiovascular response to get people heart attack proof. The mechanism is pretty clear. I already talked about one factor is throwing out more adrenaline, but long-term chronic stress, you also throw out more corticosteroids. And increasing your steroid production by the adrenal gland makes it more likely that you're going to develop insulin resistance and diabetes. So it all starts to fit together into a nice little package. We know that stress leads to a 54% increase in cardiovascular events over 7 years. This is a huge study. We know that by treating these patients, we can reverse this. We could decrease the likelihood that these people will have a cardiovascular event. We know the mechanisms that stress increases blood pressure, makes you have your cholesterol panels much more sticky, and especially the particles that I showed you, increases the risk of blood clots, increases the risk that you have cardiac arrhythmia, one of these lethal arrhythmias that can kill you, and on and on and on. Look at this statistic. The risk of a heart attack increases 230% in the 2-hour period following an episode of anger. We see this all the time. Person arrives in the emergency room with an acute evolving myocardial infarction. Well, I got in a big fight with my employer or my wife or whatever. So we know the factors involved. In fact, for years, I've been talking about doing a mental stress test on patients. And I used to do this. The physical stress test, everybody knows you walk on the treadmill. How about a mental stress test? Which you could do. You can hook people up and give them some type of mental stress. Usually we do it with arithmetic problems. But it turns out that mental stress-induced problems gives you a higher risk of dropping dead from a heart attack than walking on the treadmill. So in reality, what we should be doing is both. And what we really should be doing is decreasing those factors that get us into trouble in the first place. And how do we do that? Well, it's well chronicled. Again, if I had 3 hours, I'd love to discuss this. Exercise, the relaxation response, which my good friend Herb Benson, Brian knows Herb Benson as well, coined that at Harvard Medical School years ago. These are all simple things: meditation, prayer, yoga. One of the cardiologists from University of Maryland that's coming to the meeting wrote an article on laughter truly is the best medicine for preventing heart attack. It sends out endorphins, causes your blood vessels to dilate, improves your lipids. We know that data is very, very clear. I've always been a proponent, as many of you know, of the Mediterranean diet. And I think part of the benefit comes not only from the food, but these people gather around the table for a mid-afternoon meal, and they spend a little time relaxing. They're not what the typical American who's running around like a chicken without a head all day long, pouring out the adrenaline, pouring out the steroids. A midday nap. Now this I love. This was Nicholas Trokopoulos. Published this in the Archives of Internal Medicine. People that take a regular midday nap, and we're talking about a 15, 20-minute nap, every day cut their risk of a heart attack by 37%. That's better results than we get from statin drugs, our most powerful agents. You know, it mitigates this rise in adrenaline. Sleep apnea, which again, we're in week 3. For those people that snore, they're walking around a little fatigued during the day, that have elevated blood pressure, you got to get worked up for sleep apnea. A lot of people have it. And sleep apnea is an easy-to-diagnose condition. Now we can even do it with a little technique at home. And it basically, what happens is when you obstruct your breathing, your blood oxygen drops, and you literally stop breathing. It could be for 10 seconds, 20 seconds at night. A lot of people have that. What's the problem with that? If you have it, even the mild form, you increase your risk of heart attack and stroke. Now, I'm standing here and I'm telling you that I'm going to make you heart attack proof. So it's not just correcting the cholesterol problems. It's not just getting some it's doing the whole enchilada. And one of it is to make sure that you don't have sleep apnea. And again, it'll be in the reading material that we'll give you, and you can go through this. How about week 4? We're going to dive into nutrition. Because as Hippocrates said, let food be your medicine. And he was correct. And he's still correct. Because our best approach for a healthy lifestyle is to put into our gas tanks fuel that we should be utilizing, not the wrong kind of fuel. If you went into a gas station with your gasoline-powered car and you put diesel fuel in the tank, your car would conk out in short order. So that's what we're doing when we eat this highly processed, calorie-dense, nutrient-depleted diet called the toxic American diet. I wish I had 5 hours to talk about this, because clearly this is one of the easiest ways to right the ship. So what's the optimal diet for cardiovascular health? 2 years ago, I was invited to give a lecture in Rome, Italy, at an atherosclerosis society meeting. And afterwards, my wife came with me, and we went to this little village in the Tuscany region of Italy. And in order to get something to eat, this little tiny village, you had to get up early in the morning and go to the outdoor markets. And in order to get there, you couldn't drive there. You had to walk there. Walk through miles, about 5 miles of vineyards and olive groves. And when you finally got there, there was a virtual cornucopia of fresh fruits and vegetables of all different colors that bring the antioxidants to the table that fight off free radicals that ravage our body on a daily basis. Here's the cold water fish that brings us the omega-3 fat that's equally as healthy. And of course, here's your red wine with the resveratrol and the polyphenols. Ansel Keys, who was a